Afternoon, everyone, and first of all, thank you to Elsevier for inviting me to speak on this particular topic, because it's actually something that certainly within AstraZeneca we've grappled with for some time now, and especially over the past year. First of all, this is a picture of Amish haystacks. You've heard the expression finding the needle in the haystack. Well, for us, it's not about the needle, it's actually about the haystack. In terms for our users, is understanding, well, which of the resources actually has that information. In terms of our stakeholders, and in particular for our budget approvers, is understanding, well, what's the differences between the haystacks, and why do we have so many or so few? So what I'm going to be talking today is, well, first of all, the challenges that we're facing within our industry, how we are addressing the measuring of ROI, and then the approach that we're taking within AstraZeneca in looking at tackling these challenges. I have to say that this is an ongoing activity. We certainly haven't perfected it. And I think there's a lot of discussion in there as well. But what we have found is that we've had some quite positive responses from our senior stakeholders to these initiatives. So first of all, well, within the pharmaceutical industry, and I'm not sure how many of you are in there, I know that there are some. I recognise some faces here. And as I said, along with those pharma companies, we're facing something called the patent cliff. And the patent cliff is something that's happening from now through to 2013, where leading products are going off patent. So in the case of AstraZeneca, we're actually going to be losing patent life on our two key products, Nexium and Seroquel. It has been found that in the first year after the end of the patent life, sales for that leading product could drop by as much as 80%. So this has been one of the challenges that AstraZeneca has been coming, and certainly we're in today. In addition to that, you've also got the regulatory environment, which has got much tougher. It goes without saying, I think, we're seeing that we need to be making safer medicines with less side effects for our patients, and absolutely right, we should be. In addition to that, and we've seen it in the world, is the economic environment. We all know what is happening today. So all of these, unsurprisingly, leads to budget cuts. So that's one of the big challenges for us. The fact that we are not able to fill that gap from now to 2013 also means that we are looking at changing business strategies and changing business models. So the reality is that I think one of the things that you will find that the AstraZeneca today is quite different from AstraZeneca 5 years ago. So there's been a lot of initiatives that have been looking at our processes and our service support and understanding, well, if it doesn't add value and is not core to the discovery of medicines, then we should be looking at outsourcing. So those processes and those support services have been steadily been outsourced. And then a key example, and I think it's probably applicable to quite a few of your companies, is around IT support. The third point being that we in the business need to be much more creative. We have to be innovative. The ways of working in the past have not delivered the new molecular entities. So we're not producing drugs. We've got to be much more innovative, got to be much more creative. It's encouraging to hear from Alexander that that's one of the things that is being recognised as a challenge for the customers with regards to being innovative with the way that we work. With all of these changes in strategy and models, you also have internal organisational changes. So as it happens, we're undergoing another reorganisation. I think you're kind of familiar with that one. So it's one of the things where we've experienced quite a few times over the past few years, but the fact is that our users still need to access published information. They still need to access good science. And then the final point, and actually that's the biggest one, is perceptions. When information is free, why are we paying for it? And this is where it goes back to Alexander's comment about good enough content. You know, many of our users today, including our senior stakeholders and those budget approvers, they use Google, they use Wikipedia. And so for them, it's trying to understand, well, why are we paying for this when actually we might get enough from looking at the web, the World Wide Web, with its free information and open access resources. Then the second point is also the fact that as we are contributors to the production of that information, why are we buying it back? And that's one of the key challenges to us from our users and our customers within the business is trying to understand that. So in terms of measuring return on investment, so what do we do? Well, probably most of you will be very familiar with the triangle where you have the cost, the quality and the time, and it's about a balance of those three corners. So you're looking at the cost per user and the cost per usage. You look at the cost per download, understanding, well, you know, if we buy this subscription to this journal, how much would it cost to access that compared to a document delivery and paying through a service provider that way. We also look at one-off statements, so we extrapolate savings in terms of the scientist's time, so we know how much a scientist is worth in the company, and we then estimate how much time it saves versus the cost of the access to the information. Another key aspect that we've done in measuring return on investment for AstraZeneca is that the library have generated quite a significant savings through globalization. So globalizing our contracts, globalizing our service. So within AZ, we only have one library. We also have a single process for managing that paid information. And then in terms of procurement, you have the understanding of tangible savings whereby you cut costs of licenses by either reducing the size of the license or good negotiations, and intangible savings where you look for cost avoidance through either reducing your annual increase or being able to avoid another department buying the same kind of resource. But so all of these measures actually, it helps to justify the costs that are spent on published information. i.e. we've got good access, we're good negotiators, we have a good breadth of information, but these alone are not good enough to prove the return on investment, as it doesn't tell the full story about the impact on the business. What is the value? From an AstraZeneca point of view, to be honest with you, this triangle, which is pretty much equal, we've actually focused a huge amount on cost. And I would say that it's the cost side that we've been trying to decrease. But the challenge back now from the business is, well, okay, so what? You know, what is the value? And this is where I would say that actually it's about measuring return on intelligence. And when pulling together this presentation, I actually came across is a Dow Jones ebook series on return on intelligence. I don't know whether some of you might be familiar with that. And in it, they describe an activity that they undertook with Accenture in 2005, where they focused on time savings in an aspect of knowledge management, which was knowledge exchange. They were able to demonstrate that for every dollar spent on knowledge exchange, they were able to save $25. So it's worth a read if you are able to find the time for it. But I particularly like the fact that it is about measuring return on intelligence. It's understanding, well, paid content is about supporting the business and the impact on the business when providing that access to that type of information. So when supporting the business, we want to be able to support them in making informed decisions. So it shouldn't matter if the information is internal or external, and it shouldn't matter who the publisher is, as long as it supports the arguments, can be validated and is trusted. Need to be able to access that information quickly, so saving time by having access to that right information, and also being able to access it in the right way. So depending on your job and what the job of the user has within the business is relevant to how they should be accessing that information. So there was a mention about mobile devices. Also, in addition to that, it may not be a web access product, it may be a direct feed. We might want to integrate that information with our own internal info, but it's very much dependent on the job. Not everyone in the pharmaceutical business, within R&D, need to have the same access. And so that kind of flows into the third point about integrating information into the user's workflow. So over the past 5 years, I would say that within the library function at AZ, we've been very good at pulling all of this information into one portal page. So it doesn't matter where the user sits, they're able to come to that page and find the resource they need. But that's no longer good enough. We have to take it to the next level. And that means pushing that information into the person's workflow. So when they need it, they have access. And also, in terms of understanding, well, how does that stimulate innovation? Well, if the information is there for when they need it, sometimes they don't even realize they need it. And it's a good prompt and a good stimulant for them to consider what information they should be accessing. So I would say that the final point about stimulating innovation is absolutely critical. In order for our scientists and our business to be much more creative, they need to have access to the world's knowledge. They need to have access to good, validated, paid information. So how are we in AstraZeneca actually addressing the challenges? Well, these are just some of the suggestions that we've been looking at this year. Continuous marketing is absolutely essential. You have to separate your brand from the name of the organization. That's something that we've come to recognize. And it's something that we want to try and future-proof by doing that. You need to also be able to define the value of your services in terms of what the user would be able to understand. And this comes down to your elevator speech. So if you were in the elevator with the CEO of your company and he turns around to you and says, "So what do you do?" In those few minutes, you have to tell him how important your role is and and how much of an impact on the business you have. And so you need to know your elevator speech. Earlier this year, we ran a customer satisfaction survey. We actually rolled this out to users across AstraZeneca. It was about 4,500 people, and we got about a 20% response rate. And within the questionnaire, we actually included business impact questions, not just about the services and the products that we deliver, but business impact questions such as, using AZ library services has saved me time, has supported me in making strategic decisions, has helped me to generate revenue. So it's those kind of business impact questions that we put in there. And we found actually over the year when talking with our senior stakeholders that it's been very useful to be able to pull out that information and to show and demonstrate the effectiveness of our service. So, I mean, it's very pleasing to see that 97% of our users agreed that, using our services has actually saved them time.